journey of 2 years?
So, I joined DIAMS for 2 years course, a regular batch, and I would like to tell all the students that notes of the classes are very useful. If you are doing books, it is very difficult to revise all the things 2 to 3 times. But if you read book one time and go through the notes add up,
multiple times.
Add up whatever what you like to add up in notes and go for 3 to 4 times. If you revise multiple times, it will very helpful to you. And
so in NEET exam, it is more about, do we have repeat questions or is it new questions?
so, there are some repeat questions. Topics are repeated.
Topics are repeated. So there is no point of cramming, and I think understanding is much important. Okay. So doctor, how did the image-based session that we conducted be beneficial for you?
Image-based questions are very helpful. That once you see an image, then if you get a questions like that, same image will not be repeated. But if you can decide how can you approach the question, what you will see, where you will see the image, where is the problem in the image.
Okay.
You can go according to it and analyze all the options and get to the answer.
So doctor, how many revisions did you do for this exam?
So I did 4 times, 3 to 4 times notes I've revised.
Okay.
Then
So it's like, let me put it like this, last December, right, December 2017, people are going out for weddings, people are celebrating Christmas, and you are studying. So I mean, how did you orient yourself to that? Because we doctors sacrifice so much, and you are one of those people who have sacrificed and have come out with flying colors. So let me say, day in life of Dr. Bansi in December 2017. So why don't you share, what were your feelings then?
Yes, we all have weddings and all are celebrating the New Year's, 31st parties, and we have to, I thought that I'll do everything in life after I get married.
Okay.
If I will read for 1 month very seriously, then I'll enjoy life throughout.
Okay. So you are using that carrot and stick policy, and you're saying, okay, once I clear this limit, then I'll do everything. Okay. Then
I'll go for a trip, then I'll go for a family.
Okay, family functions. Yeah, absolutely. That's a very good approach, because what I think is people tend to mix up everything, and that rather sends up a vicious cycle of depression that a lot of doctors usually suffer from because they're not being able to practice. Okay, so we fast forward, let's say 1st January 2018, and you were like 6 days away from an exam. So what were you doing then? Those 6 days, what did you do?
So then I decided in last 6 days, I revised first and second year subjects 2 times. I would try that I can complete in 2 times, but I have completed 1 time. 7 the main basic subjects which can help us to score more and more.
Okay, so your strategy was to focus on anatomy, biochemistry, physiology, and you revised it in 1 to 2 days. So a lot of people at the moment will have query, like they might say that how is it possible to revise anatomy, biochemistry in 2 days? So how did you go about it? How did you focus on topics, or was it whole thing that you were practicing?
No, sir, topics. I have first done the MCQs in the last exams, last 3 to 4 years, and then I before a month I prepared a list of topics, and then in last week I revised the topics. In first and second year subjects, questions are numbers of questions as compared to the gynec medicine are less, but they are scoring, so I go for the topics which are very important and which are repeatedly asked in the exams.
So doctor, one more question to you, especially for my subject, internal medicine.
Yes.
So how was your experience with internal medicine at DIAMS, and any inputs you have?
Yes, sir. Your notes, and I'm really a very big fan of your teaching method. You taught about us first go through the question, read it, and try to make a analysis and try to reach the diagnosis. Then read all the options given, and then find out the right answer.
So analytical approach.
Yes, sir.
Okay.
In your notes, I have revised medicine 4 times.
Wow. Okay.
But I revised your notes only, and I also followed your book, which is very helpful.
Okay, okay, okay. So that's another point, doctor. Like a lot of people say that Facebook is a waste of time. So what are your views about it? Like suppose you were in my medicine forum. So was it productive? Was it a waste of time? Or you get spam on that? So I mean, how should you judiciously use it?
Yes, Facebook is waste of time if you go for it. Well, there's also distraction.
Scrolling.
Scrolling.
Okay.
But the MCQs you put, which are very new, which explanation something you come to know about new things.
Okay, so suddenly it provokes your mind, right? It hits you. Okay, this is something new, and I had not studied, so you tend to push yourself harder.
Yes.
Okay, okay. So that's one of the objectives of actually.
Sometimes we learn a whole topic and we miss it, the main part. Sometimes when we come through this MCQs, then we come to know that I missed it.
Okay. And what's your take? ECG should be studied?
Yes, sir. ECG
should be studied. No, there was no question on ECG. No, people said it's a waste of time.
No, sir. ECG, it's not only for about MCQs. If you are going in ahead life.
Okay, analytical approach. It fires your neurotransmitters, and you tend to, at least try to analyze the data. Okay.
And it's a first time. It's like ECG is not asked, so it's not like the future.
Okay.
Okay.
So doctor, can you share your email ID, because a lot of people would be very interested in asking their doubts from you, especially with respect to the fact that how to prepare, because we have tried to do that in this video, but maybe there are some aspects which some students might be facing, and they would be more interested in directly having information. Though you can mail me at marvamedicine@gmail.com, and I can forward the mail to Dr. Bansi Popat for her expert views, because she has been through this NEET exam and she has emerged a winner with an awesome score. Doctor, you can just share your email ID if you're okay with that.
Yes. Yeah. My email ID is bansipopat186@gmail.com.
Okay. Yeah. So that would be, I think, very extremely beneficial. If you have any queries, you can send it across.